Hi, this is Stephanie Snikowski of Snikowski Insurance, here to present to you today a presentation on Medicare 101. This will cover how to apply to Medicare, a summary of some of the preventative benefits, the amounts, savings programs, secondary insurance, Medicare supplement, and Medicare Advantage. If you have any questions, please don't hesitate to reach out. Thank you. What is Medicare? Medicare is for folks over the age of 65, folks who may be disabled regardless of their age, and folks diagnosed with end-stage renal disease, again, regardless of their age. There are two ways in which you can obtain Medicare. Option one is your original Medicare, your red, white, and blue card. That includes a supplement plan and prescription drug. The second option would be the Medicare Part C with everything under one umbrella. That includes the hospitalization, the medical, and the prescription. This slide covers applying for Medicare. If you get Social Security currently, the enrollment is automatic. If you are not currently receiving Social Security, then you would need to apply during the 7-month initial enrollment period. That 7-month is 3 months before you turn 65, the month of your 65th birthday, and 3 months after you turn 65. So that would be the 7-month initial enrollment period from which to enroll in Medicare. You may enroll through your Social Security office, through the Social Security online portal, which is an easy process, or calling the number listed in the slide. A special enrollment would be applicable based on your group health plan coverage if you or a spouse is still working. I would recommend that based on your circumstances for the size of employer that you reach out to myself or to your HR representative to review in more detail. Medicare Part A is your hospitalization coverage. The hospitalization includes inpatient, skilled nursing, home health care, and hospice. Your Medicare Part B coverage is your medical outpatient services. That would include outpatient hospital, your office visits and specialist visits, durable medical equipment, and preventive health benefits. Medicare doesn't cover everything. This is a brief summary of what Medicare doesn't cover. If you are interested in dental, eye, or travel outside of the United States, there are carriers that offer these particular plans for a very reasonable premium. Reach out if you have questions regarding anything that is not covered or that you may want to purchase separately. This slide is a summary of the preventative benefits. The deductible and coinsurance are waived for most preventative care services. I would touch base with your physician based on the diagnosis that would be used, as that does have a reflection on how that claim and service is processed by Medicare. If you'd like a full listing of the Medicare preventative benefits, reach out and I'd be happy to get to you the full booklet of all the preventative benefits that Medicare covers. This slide is a summary of your Medicare cost, your Part A hospitalization cost, and your Medicare Part B medical cost. Be sure to review this, and if you have specific questions, please don't hesitate to reach out. Hi, this slide is a summary of the Part B premium cost based on your individual tax return or if you file jointly and what the premium would be depending on that income. Most folks fall in the 144.60 monthly premium. However, again, if you're in the upper income brackets, be sure to review these other premium amounts. This slide reviews the Medicare savings programs for folks with a limited income and limited resources. There are 4 different levels for which folks may qualify. It is important to call your Ohio Medicaid hotline or your local area agency on aging to see if any of these levels are applicable to you. In choosing a Medicare supplement plan, it is important to know that all plans are standardized. All companies sell the same plans. However, those premiums may vary between the companies. If you have any questions in choosing a Medicare supplement, don't hesitate to reach out. Depending on your circumstances, you may have a secondary insurance. That could be a group health plan for you or your spouse's employer, Medicaid based on your income, or if you choose a Medicare supplement. This slide summarizes Medicare supplement changes that went into effect on January 1st, 2020. If you were eligible for Medicare prior to January 1st, 2020, then all the alphabet soup Medicare supplement plan options are available to you. If you were eligible after January 1st, 2020, you no longer have the choice to purchase Plan C or F. This slide is just a summary of what you would receive with original Medicare. Your Part A hospitalization, Part B for medical, your secondary insurance if you opt to have a medical supplement, or if you have a group health plan, Medicaid, and then in addition, you would need to purchase a separate prescription drug plan if you do not have it available through an employer or group health plan. Medicare Part D prescription drug plan, or PDP, is coverage offered by private companies that contract with Medicare and is available as a standalone PDP plan or through your Medicare Advantage plan. This slide is a summary of what your out-of-pocket costs could be with the prescription drug plan. If you have significant prescriptions that you receive, please reach out so that we can find the best plan for the best cost based on your utilization. If you do not enroll in a prescription drug plan when you are first eligible, there is a late enrollee penalty, 1% for each month that you delay coverage. It is important to review your drug plans each year based on the network, the preferred pharmacies. The coverage could have changed with the formulary, and then the cost. You might find a different carrier that provides less out-of-pocket cost based on the medications you are taking. Depending on your income and limited resources, you may be eligible for the low income subsidy, which has a reduced or no premium, reduced or no deductible, and reduced copayments. Reach out if you're not sure if you qualify for this program. This slide is again a summary of your Medicare options. Option 1 is the original Medicare. Option 2 is the Medicare Advantage. You may enroll in a Medicare Advantage during your initial enrollment period, which is the 3 months prior to turning 65, the month of your 65th birthday, and the 3 months following when you turn 65. You may also enroll during open enrollment and can change plans during the open enrollment every year. And then Medicare Advantage also has an enrollment period from January 1st through March 31st, in which it allows you to switch between Medicare Advantage plans. Reach out with your specific questions. Medicare Advantage is an alternative to Original Medicare. It is offered by private companies that includes HMO and PPO plans with networks, premiums, and copayments that vary by the private companies. If you're enrolled in both Part A and Part B, live in that service area, there is no age or medical restrictions to enrolling in the Medicare Advantage. This slide is a summary of the guarantee issue, which is no medical underwriting, or if it's not guaranteed issue, which does require medical underwriting when you move between options. Reach out with your specific questions. So in summary, we have Medicare supplement that can be purchased with your original Medicare, and we have your Medicare Advantage that is everything included under one umbrella. Please be sure to review the specific costs based on your circumstances and your budget, and reach out with your particular questions. Thank you for taking the time to review the presentation.